Hey everyone, it's Russ Thornton with Wealth Care for Women, and today I am excited to be joined by Clarice Fleming from Caribou, who will introduce herself in just a moment. For those not familiar, Caribou is a healthcare consultancy. I've been working with them closely for the past several months to bring another layer of expertise and guidance and education to my clients when it comes to reviewing and or making their health coverage decisions, whether that's with a current employer as they transition to Medicare, or as the topic of today deals with, dealing with college age students or college age children. So, Clarice, I'm super excited to have you share this with us today. Why don't you start by maybe taking 60 seconds and telling the folks a little bit about who you are?
Yeah, thank you, Russ. I'm happy to be here and welcome everyone. As Russ said, my name is Clarice. I'm health planning coordinator at Caribou. I have a decade of experience in the industry in healthcare specifically. My passion, what I love, is healthcare education, providing upfront advanced planning, knowledge, information, and advice and support so that we all can be empowered to make good healthcare decisions about our insurance, about our coverage, about our access to care in advance, and then we reduce or eliminate as many financial surprises as possible. So that's kind of what I live and breathe for. And this is perfect because we've got children dependents who are headed off to college or they're college age. They're in that period of time where they're learning, they're soaking up the world and life and everything it has to offer. So maybe they can soak up a little healthcare knowledge at the same time. And that's just ideal for me. So thank you. With that, I will sort of dive right in. We have this presentation today, Healthcare for College Students. What are my options? And as I assume we have a lot of moms and dads in the crowd, it'll be healthcare for your children's options and what can they look through. I'm going to go over some life events, reasons why you would consider other coverage. What is the Affordable Care Act and how does it benefit you as a consumer? Comparing benefits and value across six different insurance options and having the tools to really be able to assess which plan is the right one for me. What are the enrollment windows and timeline considerations? And then how can a health planning analysis help? So, things to consider, reasons why you might consider evaluating your healthcare options for your dependents. Maybe they're moving out of state. Maybe they're going to a college in a different state that got accepted. Congratulations, all of you who are. But it's a big step. It's a new home, it's a new environment, and they need new healthcare. Maybe they have different healthcare needs from the rest of the family, and a plan that is uniquely suited to what they need, carved away from the rest of the family plan, is beneficial. Perhaps there's cost saving opportunities for everyone involved, and it encourages healthcare independence, which unfortunately at the age of 26 they have to have anyway. We're going to just push them out the nest whether they're ready or not. So giving them this window to kind of start to gain that healthcare independence and that confidence is so great and so critical. Here are some relevant life events that will impact healthcare cost. The slide that you're looking at is all of life events, including as you age and retire or look at Medicare, but I've highlighted the ones that I think might be relevant for our college age dependents. So, resident changes right in the middle. They're moving to a new state, they're going to a new college, a new area of town. Cobra, maybe they're leaving a plan and they're exploring Cobra options. They could be losing coverage through your family plan or through a family member. They could be losing eligibility as a student plan, aging off of your plan at 26, which is a thing that happens. I circled the household changes. I don't know if anyone has a dependent under the age of 26 who is looking at getting married, but if they get married, that's going to force them into their own household as well. So that could be a big change. And then these ones on the bottom right, other, maybe they're just looking for better options, curious about what's available, or if there's a cost saving initiative for them. So all of these life events should trigger these kind of thoughts of, what else can I have and what could I look at for coverage options? All student insurance must be ACA compliant, the Affordable Care Act. And this is a huge ruling that has really had a knock on effect on what options are available for our students. I know you're thinking, what is the Affordable Care Act? Why do I care? ACA was signed into law in 2010. It increases healthcare accessibility, so the access to healthcare, affordability, so making it more affordable means more people can afford to access what they have available, and patient protections. It's really responsible for huge policy changes, and one of those being that students in college must have health care, which has then led a bunch of universities and colleges to start offering student health services, student health care plans directly through the university rolled into your tuition costs. So it's all kind of incorporated and housed there on campus. So that has been a huge sort of knock-on effect from the Affordable Care Act. What's in it for me? Why does it benefit you as a consumer? Well, the increased accessibility will give you access to a marketplace. So any state, any place that you are, you can purchase a health plan and review them across multiple insurance companies. It might reduce your costs by getting a premium tax credit or a subsidy, and it expanded Medicaid. But that's not what we really care about. Let's talk about the one that we all know to be true: increased protections. Pre existing conditions cannot be used to deny you coverage or increase your cost, which is awesome. And the big one: children can stay on our plans until they turn 26, which means we all get to house the premium cost for our children until they're 26. So it's actually a really huge blessing, I will say, from one of my experiences in college. My parents helping to pay for my health plan was very, very beneficial to me. So I'm sure they're grateful for your premium contributions, as it were. But it's a big one that will give them a little breathing room to assess while they're in college whether or not they're ready to be healthcare independent just now, or whether they want to wait until that 26-year-old deadline. Um, and then also things like the insurance companies can't limit the amount that they'll cover. They have to cover 10 essential health benefits. So if you're wondering, what does a health plan that is ACA compliant mean? It means they must cover these essential benefits. Outpatient costs, emergency services, hospitalizations, those are pretty standard for all healthcare. Mental health, substance abuse and pregnancy, prescriptions or pharmacy medication, again, kind of standard. Rehabilitative services, this could be like physical therapy, occupational or speech therapy. Laboratory services is like when you go to your annual exam, you get your blood drawn to see if your cholesterol levels are good. That's a lab service. And then, of course, preventative medicine and pediatric services. So all college or student health plans will cover these minimums. Marketplace plans, exactly the same. They will all be ACA compliant. Most, I would say, a good 90% or higher of employer plans cover these essential benefits. A plan that does not cover these would not meet the criteria for being ACA compliant. So now I want to kind of switch gears. We're going to talk about comparing options between multiple plans. How do you evaluate the benefits and the value of a plan? So how do you know what one plan is better than another, or if it's cheaper, or if it covers more? How do you make that choice? The easiest one is cost. Which plan is the cheapest? So in here, what you're looking at, this table is a 3 plans side-by-side comparison. The far right is your current coverage. So maybe this is the family plan you guys all have. The middle is Cobra. So if your dependent were to leave the family plan and elect a Cobra version of that plan. And then the far left is an option for new coverage. Maybe we're looking at a student health insurance plan or a marketplace plan, but we're looking at new coverage. If you take the monthly premium, that top line, and you multiply it by 12, you've got an annual premium amount, the amount that you're going to pay every year just to purchase your health insurance. This is just to buy your membership with that company. If you never ever go to the doctor, if you're very healthy, you're still paying that annual fixed cost. So you can see the red circle on the far left is the cheapest plan that you could purchase on a monthly fixed cost. But then let's say you use your healthcare a lot. You're a high utilizer, lots of services, lots of medications, maybe a surgery or two, and you're going to blow through your deductible and reach your maximum out of pocket. The worst case financial responsibility, or what we call a maximum exposure, takes not only your annual premiums, but your maximum out of pocket. So, in the event that you use a lot of healthcare and you reach that out of pocket maximum, what is the most exposure you can have financially in a calendar year? And you can see here the current coverage is that. So when people say, what is the cheapest plan? Sometimes they mean which one has the lowest monthly cost, the most coming out of my, pocketbook every month. Other people mean, what is the lowest financial exposure? I use a lot of healthcare and I want to pay the minimum amount for all of my care and my premiums. And those two red circles can really help you identify, really, if you're looking just at dollars and cents, which plans kind of measure up. We also, after cost, we want to look at things like the plan type and the network size. Does my family plan cover my dependent living in another state going to college? Does the plan that they're going to cover them when they travel for spring break with their friends or when they come home in the summertime? So you're going to look at the network size, who their providers, whether they're in or out of network on a nationwide scale or state by state. You're also going to look if they have out of network coverage. Can my son or daughter see someone who isn't in the network? PPO obviously is the largest network and the most out of network coverage. It's the most robust. A lot of employer plans with PPO plans will be nationwide. If you're on an HMO or an EPO, you may have a smaller restricted network. It may be a state local only network. There definitely is no out of network coverage. And then, of course, POS is not as common. You may maybe not have heard of that. It's a point of service or point of sale type of plan. And the last level that I kind of want to talk about right now is personalization. Once you know which plan is the cheapest, which plan is going to cover the network that they need, let's start looking at my individual situation or your child's situation. What are the doctors that they want to see regularly? What are the medications that they might take? And are they covered under this plan? You can put little gold stars on there, smiley faces. You want to get stickers and give them a thumbs up or a thumbs down. But essentially, if you're looking at this kind of level of personalization and you have a plan that comes back that's really cheap, really affordable, but only covers, two out of their four doctors, you might put that in the maybe pile. You might be like, it's a really good price, but I have to change two of my doctors in order to use that plan. If you get one back that's got all zeros or X's and nothing's covered, well, that's going straight into the no pile. So that can really help you analyze your plans as well. So now that you have the tools to compare these side by side, let's talk about the coverage options. What is available for my college age dependent? They can remain on a family group plan. So with mom and dad and maybe siblings, they can enroll in a student health plan through their college. They may be able to enroll in Medicaid if they're eligible and meet the income requirements of low income or no income. They can enroll in a employer sponsored plan. Don't discount night and weekend and evening jobs, those part time coffee or cafe or waiting tables. Some of those come with benefits. There also are internships that have paid benefits as well. So maybe they're taking an internship at a company over the summer or as college credit, but that internship comes with a benefit option. They can also consider enrolling in Cobra and in an individual marketplace. So I'm going to go through all of these and kind of talk about pros and cons for you. They can remain on the family group plan. The benefits, there's no changes to the coverage that they're used to, the provider networks that they have. It's all everything the same and very familiar and comfortable. Parents will probably continue to cover the monthly premiums. You might pass on that fee if you want to, but most parents will cover the monthly premiums, so it gives them a little financial breathing room. And some parents can help with even the deductible or co-insurance expenses as well, especially if it was a large, say they had a surgery and it was $1,000 deductible. Parents can assist with that. Another good selling point is that parents can help with medication and care plan adherence. So if you know your child gets an asthma inhaler every month or maybe an allergy medication and they refill it every month, when they're on your plan, even when they're living in another state, if you haven't seen their allergy medication come through the system twice, you can call them and say, "Hey, you haven't refilled your allergy medication in almost 2 months. How you doing? Are you still taking it?" So you can kind of help them maintain their health and their care plan through that. Some considerations, I don't want to call them cons, but they're things to keep in mind. If your child is out of state, your family health plan may not cover them in the area that they are. So you need to make sure that they have a nationwide network for them. You might be missing out on potential monthly savings. Even having them on a separate plan and paying two different premiums might still be cheaper than having them on your family plan. And they won't have full healthcare independence just yet. They'll still be on mom and dad's plan. So there's like a transitional period, as you were. Now I'm going to talk about student health insurance. This is maybe one of the most common when you go to college because it's very simple and easy to do. Some of the benefits, they're going to gain a little bit of healthcare and financial independence. They can get a health plan that's tailored to their location and their needs for their college-aged, healthcare. And many student health plans have additional age-appropriate services built in the plan, which I'm going to go over in the very next slide, but they're actually kind of important. Some of the considerations, they're solely responsible for their healthcare costs and management. I say this, most of the colleges will actually put the healthcare costs in the tuition. They'll roll it right into the tuition. So if you're paying for your child's college tuition, then that cost is still coming back to you. But if they're not, if the tuition's been taken care of in another way, then they'll be paying for their costs in above and beyond that. It can be more expensive than other options, and it may require that they change all their healthcare doctors to find doctors in and around their college and campus area. Something else that's really important is the eligibility of the summer. Some colleges, and I would say it's about 50-50 split down the middle, some colleges run from the fall, so August, September timeframe, all the way through to the following year in June, and they stop. They do not cover the summer months. They assume the children are going to go home and spend time with mom and dad and be covered on their plan or some other coverage. So you actually have a 3-month gap. Some colleges have started offering a year round plan. And this is great, especially if your child isn't in the dorms anymore. If they've gotten an apartment, they have friends, roommates in the area that they're living with, they might stay through the summer. Maybe they get a local job. And so having that year round coverage really benefits them. That is something you definitely want to check so that you're prepared for whether or not your student will be jumping on and off different insurance plans periodically through the year. So let's talk about those on campus services. Because student health plans have become so popular, because the fee is rolled right into the tuition, many campuses have started putting a health clinic or health center right in the middle of campus, which is very convenient. Same day primary care visits, you can just drop in and get seen right away. Sexual and reproductive health, counseling, psychiatry services, allergy, immunology medicine. So maybe if your child goes out of state, they've never had an allergy problem, but suddenly they're living in a new state and there's a huge pollen count and they're finding that they're sneezing a lot, they can get those Zyrtecs and Claritins right there on campus. Sports medicine is a big one I wanted to call out. Most insurance plans will cover physical therapy, which you see is the next line down, including your employer plans, marketplace plans, Cobra. But sports medicine is less common. I don't see it as often. And it's a form of physical therapy, but it's really specialized and unique. If your child is going to college and playing sports in college, having on campus sports medicine visits can be really beneficial and might be worth considering even a more expensive plan, even a cost outlay in order to have access to that. So if sports is a thing, you definitely want to check that the campus center supports that or offers that and have that weigh into your factor in your decision. Dermatology visits, wellness exchange, laboratories, pharmacy, these are all pretty common. They also, some of them do gender affirming care. Health and wellness promotion is another one I really like that the on campus services do. They go beyond just reactionary medicine and they actually promote good sleeping patterns, especially during exam times. They promote healthy eating, knowing your diet, maintaining a certain level of exercise. So the on-campus or student health plans do a lot to encourage health management as well as health care and insurance things. So it's definitely something to consider. If you choose to waive the college, which you can do if you have an employer family plan, the child's staying with your plan, there's no reason to pay for extra coverage. Most colleges will require that you sign a waiver to waive their plan. This is an example of a form I got off the internet. It's pretty standard. I've seen numerous college forms and they're all the same. What is your insurance company, the address, telephone number, who is the policy holder? They will sometimes ask for a copy of your ID card or even a letter from your insurance company. It's called a letter of credible coverage or a COCC. That letter is very standard and easy. Just call the insurance number, the customer service on the back of your card, and just say, hey, I need a letter of credible coverage. And they can email it or fax it to you same day. So with that letter or a photocopy of your ID card, you can waive the college plan. This will usually need to be done annually, every school year, sometimes even every semester. So keep those paperwork so you can keep, photocopying them and sending them back in. So let's talk about when it would make sense to explore Medicaid. Medicaid is a federal program. It's run on the individual state level, but basically it's healthcare for people who have low or no income, and it's based on income and family size. If your child is still a tax dependent and you're making an income, they wouldn't qualify for Medicaid. But if they're not a tax dependent, if they're living completely independently, a different state, and they're filing their own taxes and you no longer claim them as a tax dependent, they may qualify for Medicaid based on their state's eligibility. And that can mean either low or no cost healthcare. So it's something to check out. Most of the marketplaces will automatically enroll you in Medicaid if that's where your income falls into. So they make it very simple to access. And I'll discuss that a little bit as well. And when we get to the marketplace, employer sponsored health coverage. I don't want you to poo-poo it, even if they're not working full-time. Part-time jobs sometimes offer benefits, and sometimes internships, as I mentioned before, can offer benefits. Benefits are they gain their healthcare and financial independence. They're working for a company. They're getting benefits. This is easing them into the life that they're really going to expect, which is employer-based health plans, which is what most of the United States operates on. They are going to get a health plan that's tailored to their location where they work. Doctors are going to be in network in and around their office, and there's a potential cost savings there because employers often subsidize the healthcare quite a bit, so it can really have a savings for them. Some considerations: taking them off of your family plan and putting them on this makes them solely responsible for their healthcare costs and the management of it. Might require changing providers, and some of the companies will have a minimum hour requirement. So we only offer benefits to people who work 30 or 32 hours or more. So even if it's part-time, it might be a stressful part-time job while they're also doing college. Some companies may also have a time limit before your benefits kick in. So you have to work here for 3 months before your benefits take effect, or for a month before your benefits take effect. So there can be like a waiting period as well. And you want to pay attention to that so you don't drop their other coverage too soon. Cobra. If they are leaving your plan, maybe they're turning 26 and they're aging off your plan, or they're moving to another state and you're dropping them from your coverage, or maybe they had an employer plan, maybe they were working part time over the summer and they're leaving that now to go back to college, they can elect Cobra. Cobra option allows you to keep your current plan network and current coverage level. So everything stays the same. It's very easy to kind of just keep doing what you're used to. And it provides time to research alternate options. So it gives you a little breathing room to keep your same healthcare while you look for new things, especially if it was an unexpected change. Downsides or considerations: Cobra is not subsidized, and due to an additional 2% administration fee, the costs for Cobra tend to be some of the most expensive options we see. Across any comparison I've done in my experience, Cobra always kind of comes out at the higher end of expense. It also was a temporary solution. It's a stopgap. So it usually lasts for 18 months. In some special circumstances, it can last up to 36, but that is it. At the end of that, you must look for other coverage. So really all you're doing is delaying the inevitable of needing other coverage. If you know you're going to be going into a new plan and you need a stopgap for a few months, Cobra can be a great option to cover you the couple of months until your employer job kicks in or your college year starts or whatever that time frame is. But again, it can be more costly. This is our final option. You're doing really well sticking with me so far. I know this is a lot of information to take in. The marketplace. Individual marketplace plans are available for everyone. Some of the benefits: your child will gain their healthcare and financial independence, managing their own plan. They can have their own cost savings calculated off of their income, and a plan that they picked that's tailored to their needs and location. Some of the considerations: the exact opposite. They're responsible for their healthcare and costs and management. It can be more expensive, and it requires changing providers and potentially having all new doctors and moving their prescriptions. So there can be a little effort involved in that transition. But in all transitions, there is some effort involved. What is the marketplace? If you've not been there, it's an online superstore. It's an Amazon for healthcare. All insurance companies, so the big Aetna, United, Cigna, Blue Cross Blue Shield, they all go there along with some of the smaller ones. And the states either use like a federal system called healthcare.gov, or they have a state specific marketplace that they designed for their state. All the plans on there are ACA compliant, so they meet the criteria to waive student coverage. Their individuals or families can purchase plans, and basically it's a side by side comparison. You can just see different companies, different plans side by side, and really pick the plan that's best for you. You also have eligibility potentially for a subsidy. There's something called a premium tax credit. And this is part of the ACA Affordability Act. They wanted to make it affordable for people to access healthcare. One of the ways they do that is based on your income and your zip code and your family size. They can reduce your monthly premiums. So, for example, an individual person making $50,000 a year will get a premium tax credit that is smaller than a family of four making $50,000 a year in the same zip code, because that family of four is obviously trying to feed four mouths. So they'll have a larger premium tax credit. I have seen everything from a small $5 a month tax credit, which is, barely any help at all the way up to several $100s. At the maximum level of a premium tax credit, I have seen plans on the marketplace have a $0 monthly premium. So you don't have to pay anything each month to buy your health insurance. So they really can have a massive impact, and it depends on the income that's being used. So, ways to claim your premium tax credit. If you estimate your income, so for example, if I thought, I think I'm going to make $50,000 in 2023, when you put that in while you're enrolling on the marketplace, it will tell you, oh, your premium tax credit is XYZ, maybe $200. So as you go to apply for a plan, if I picked a plan that was $400 was the cost of it, a monthly premium, my premium tax credit would come off and I would only pay $200 a month. And it would charge me at the $200 level because it knows I have a tax credit. The downside about doing it that way is if you over or underestimate your income, say if your dependent is working at a restaurant, waiting tables, or sales jobs where they work on a commission, anything where their income is going to fluctuate a lot, they may over or underestimate their income. And if they do, it is reconciled when you file taxes in the spring. So you may have to pay back some premium tax credit if you didn't estimate accurately. The second option is you opt to pay full price for your marketplace plan. You're like, thanks for the $200, helping hand, but I'm going to pay the full $400 for this plan. And then when I file my taxes in the spring, I'm going to reconcile all of my premium tax credit in one lump sum. So that's the second option. You can kind of choose between the two. You can update your income with the marketplace. So if you want to go with option one, but you do have a fluctuating income, you can continually update that and keep them appraised so that hopefully you avoid any kind of reconciliation in the springtime. What makes you eligible for a premium tax credit? Well, you're enrolled in a marketplace plan, you're a U.S. citizen or resident, you file federal tax returns, you do not qualify for Medicaid. And this is important. If your student income drops below the threshold where they would qualify for Medicaid, the marketplace is automatically going to enroll you in Medicaid and notify you. You've been offered Medicaid. Here you go. And then the last thing is you can't be eligible for an employee plan that is an ACA compliant or covers that 10 minimum essential benefits. If you have an employer plan, you can still opt for marketplace, but they won't give you a premium tax credit. You'll be paying full price. A little bit about the metal tiers. This is kind of hard to visualize if you're not in there, but the marketplaces are all designed in tiers of these metals: bronze, silver, and gold, sometimes platinum, just like in the Olympics. The more expensive the metal, so gold, for example, has higher monthly premiums. You pay a lot each month for your health plan, but a lower deductible and a lower out of pocket amount. So your health insurance shares the cost at the time of going for services. This plan is great if you use a lot of healthcare. If you really use your healthcare, you just want a high premium and kind of set it up, and then you don't have to worry a lot about bills coming in at the time of services. The bronze, on the other hand, is a very low premium or lower premium per month, but you have a high deductible. So at the time of going to the doctor, you're going to pay more for your services, but you're paying less out of your pocket in the month. So really great if you're very healthy. You don't really ever go to the doctor except for your one preventative exam or your annual physical. You just don't pay a lot out of the month for stuff you don't need. I will say what is covered on a bronze versus a gold plan is identical. If you can see a chiropractor on the bronze, you can see the same chiropractor on the gold. The only difference is whether you're paying up front in your premiums with a lower deductible or whether you're paying a lower premium and more at the time of your services. Not every state in the union has PPO plans available. Those are those ones with a nationwide network, out of network services. So if your child's going to be going to college for some of the months, but coming home at Christmas, coming home at spring break, coming home in the summer, you really want to try and look for a plan that covers them in both states. And this is very important to be aware that you may not be able to find that. So again, if you are one of those states without a PPO plan, your child may be jumping back and forth between different, they might enroll in a coverage for this time at school, unenroll and enroll in a different plan in the summertime at your home, and back and forth. Or you can look for a PPO plan that will cover both states. They're not as common anymore, unfortunately, due to expensive reasons. People have chosen to jump in and out of health insurance rather than pay a higher premium for the PPO access. And because of that lack of popularity, they're starting to become less common in the marketplace. So the last thing I want to talk about, I think you kind of saw a theme where cost, like which plan costs the most, which plan is going to give me the flexibility to cover my doctors. There's one other thing I want you to consider when you're trying to pick between one plan and another, and this is preferences. Maybe your child wants to have an HSA account, which is a health savings account. For those of you who don't know, it's a account where you can put in money each year, tax free or with tax benefits. A triple tax benefit is what they call it. And you can save that to use on your healthcare to pay for your deductible or your co-payments, or you can save it for a rainy day. So some people invest their HSAs all the way up to retirement. Starting one at a young age, it can be extremely financially advantageous. I have seen friends and colleagues who started them in their 20s when they were in college, and their HSA balances are beautiful. And they make me jealous, to say the least. So that is something, if they really were looking at that, if they were looking at that opportunity, that's a plan that might guide their preference. Maybe they want a recognizable carrier. Maybe they're like, I want a brand name insurance company that I can trust. United Healthcare, Cigna, Blue Cross Blue Shield, Aetna, one of these big nationwide companies that is reliable. Maybe their concern is mostly about their deductible. I don't want to pay a lot when I go to the doctor. I just want to get in and get out and not have to worry about my bills. They could also consider a PPO plan, those big networks that are going to cover me across all the different states while I travel for spring break and go see my friends in their hometowns and all these different things. So, a PPO with a larger network. Maybe their preference is that they want a high plan rating. They want something that's 4 or 5 stars. Our youthful generation are also very confident in their surveys and their stars and their rating things. And so that might be something that they value. And then finally, of course, cost. Maybe they just want the cheapest plan. Maybe they're like, Mom, Dad, I'm kind of broke. I need the cheapest, most affordable healthcare plan I can get. And so maybe that risk or that annual fixed cost is the most important. And where these preferences align and how high in the priority order these preferences are is going to make it really easy for you to look at a plan and go, that's the one. That's the plan for you, because we can see where your preferences are going. So you've evaluated all 6 health plan options. You've got the cost, you've got the access to the network, you know which medications are covered, you found their preferences. Now what? We're going to talk about special enrollment windows. Before or after what I would call a qualifying life event or a trigger, you can have a special enrollment window, and it's 60 days before and up to 60 days after. These life events can be things like losing coverage. So I turned 26 and I got kicked off my parents' plan. Household changes. Maybe they get married. Moving to another state, moving to college, that counts. Changes in eligibility, maybe their income level, they're now making enough money to come off of Medicaid, or other qualifying events. So there's lots of different qualifying life events. This will open up a window. So if, say, they move to college in August, they can enroll in their college plan, even though it's middle of the year, because they'll have the 60-day window. And the same thing if they graduate and they move home or to their new place, that would also be a qualifying life event. Timeline considerations. Now, this is maybe a little bit tricky, so try to stay with me here, but student health coverage will follow the school or academic calendar. So it'll start August or September sometime. It'll go through the academic calendar to the following June. Some plans do not offer coverage in the summer months, so they'll kick your child off for 3 months and then bring them back on. Some colleges have started, because of the popularity, as I said, to offer those summer months. So it'll actually start August, September, and run through to the following August, and then that will be the plan year. This is when your deductibles restart, your out-of-pocket maximum, they all go to zero, and you start counting again. So it can be a little tricky there. The waiver deadlines to waive your college plan and stay on your family plan or get your marketplace plan is always going to be in the academic calendar. If you're lucky, your college will take it once a year. Start of the year, every year you fill in your waiver. Some of them are as much as every semester or every quarter. You have to send in that waiver paperwork. If you miss it, they will roll the charges into your tuition. So don't miss that deadline. Marketplace coverage. They follow a calendar year, January 1st to December 31st. Open enrollment's in the fall, and you'll be picking your plan for starting on January 1st and running the next year. Employer coverage usually follows that calendar year. There are some employers, it's less common, but a few employers will do a July through the following June. So say July of 2023 to June of 2024. And then in July of 2024, your deductible resets to zero. Here's what I want you guys to avoid in all of this trickiness. If you're on an employer plan that is a July to June, and your deductible for your family resets in July. So everyone starts going back to zero. You have a dependent who uses a lot of healthcare. Maybe they got an injury in sports, and so they've been doing physical therapy every single week all summer long to get ready for the new season. Maybe they're on allergies or an expensive inhaler. If you start accumulating that deductible July and August, then they go to college and they get a college plan and they reset to a new deductible in September and they're starting to get their new deductible. And then at the end of the school year, next May or June, they come home from college and they go back onto your plan. They're going to continue counting your deductible until the deductible reset in July. I want you to avoid 3 deductibles in one calendar year. That's a lot of resetting and a lot of recalculating healthcare expenses. The same could be if you were on a student coverage and then you're switching to a marketplace. You could find that you switch halfway through the year, you have a new deductible, and then in January, the plans start over and you have a new deductible then. So it may be kind of tricky to navigate that jumping in and out option. Launching off your parents' plan, or some people call this aging out. So it's less of a celebratory launch and more of a kind of being pushed out of the nest. But when your child turns 26, they're no longer a dependent on your health plan. So if you're on an employer based coverage, if you work and you get your health insurance through your employer, the end of the month that they turn 26, so if their birthday is June 15th, June 30th will be their last day of coverage and they'll need new insurance for July 1st. If your family is on a marketplace plan, so maybe you own your own business or you're self employed, or the marketplace plans are more affordable than your employer coverage, they can actually stay on the plan until the end of the year they turn 26. So if they turn 26 on June 15th, December 31st of that year will be when they come off the plan. So if your child has a January 2nd birthday, woohoo, you get a whole extra year of paying their premiums until December 31st when they will be on their own, healthcare independent, managing their own finances. And I have every confidence after watching this presentation, they're going to feel excited and thrilled and empowered to do so. How can a health planning analysis help? You've seen a few of our side-by-side comparisons in this presentation. I've had a few of those charts in here. Essentially, what Caribou does, what we do here, is we put plans side by side. We do financial comparisons. We look at their healthcare utilization, their preferences for network access, doctors, medications, and more, including, do I want an HSA? Do I like a name brand carrier? All of these preferences and all of their healthcare utilizations and their finance and budget preferences are calculated in to really highlight side by side comparisons on which plan is the right choice. More than actually getting the analysis, it's about having the conversations to help your dependents start to make these choices, start to think about what do they value in their insurance or their risk tolerance, what do they value versus cost for access to healthcare, and helping them begin to navigate these choices on their own. So that was a ton of information. Thank you, Russ, and everyone for bearing with me. I will open this up for if there's any questions.
Yeah, thank you, Clarice. This was great. As I've shared with you in prior conversations, I always learn something when I spend time with you, and today was no exception.
Thanks.
One thing I do have a couple questions that I would love to get your impact or your feedback on, but before I cover that, you mentioned at the outset that this webinar and this information would be great for people with college-age children. As Clarice, you probably are aware, a lot of my clients are a little bit older, and so they might have grandchildren that this would be super appropriate for. So feel welcome to pass this video along to your adult children who might have children of their own who might find this information helpful as they're navigating some of the choices that they may be facing down the road. Um, a couple questions, Clarice, that
Yeah.
come to mind after seeing you walk through this content. So I know different family plans price the premium cost differently, and some it's a family plan, whether you have children enrolled or not. Some there is additional cost for children. So let's say that there is no cost difference if the family plan were to drop dependents. Would you What are your thoughts about letting that policy coverage continue to run while the student maybe pursues their own health coverage if they deem that it's a better choice or more cost effective?
Great question. I'm actually really glad you brought this up because it opens up a whole new thing about coordination of benefits. When someone has dual coverage, so we're on mom and dad's plan, but I also have my cool college plan, which gives me my sports medicine, my on-campus same-day appointments. It's very cool. It will prevent you from having that jump back and forth. I'm on one plan in the summer and a different plan in the fall. That would be very convenient. Here's the downsides. You're paying two premiums, maybe not you directly. Maybe you're paying for your employer or family plan, and there's no cost difference to dropping or adding names to it. So it's irrelevant whether or not you do. But your child will also be paying for their student health plan rolled into their tuition. So their tuition will go up as a result. So essentially, this person's double coverage, and you're paying that. Unless you use a lot of healthcare, or the healthcare covers different things. So one plan maybe covers chiropractic care but not acupuncture. A different plan covers acupuncture but not chiropractic care. It's kind of a rare example, but just in case, maybe it's worth it to pay two premiums to have access to both services. But you would have to use those services enough to warrant that annual fixed cost of purchasing that health plan. Otherwise, it's very rarely financially viable to have dual coverage. And here's why. There is something called a coordination of benefits. So a primary plan will always pay first, and then the secondary plan will pay just as much as they would normally have paid. But if the primary paid most of it, they won't make a payment at all. They'll say, oh no, the first plan covered as much as we would have. So we're not going to cover anything additional. Some secondary plans even have what we call a 50% reduction for being secondary. They will only pay 50% of what the standard plan valuation is. So they can even offer less benefits than what they would normally have done. In the event that you have a family plan and your child gets a new plan, whether it be marketplace or college plan, your family plan would be primary because it has been in effect longer. The plan is a longer tenure, if it will, than the new one that they've just elected. So even when they're in college in another state, their doctors would still have to bill your employer health plan. It would apply to your family deductible and out of pocket and things like that. If it processed and paid, great. If it denied, it would go to the secondary plan, the college plan at that time. Then the claims could be processed and paid. Downside is double the paperwork. You're having your doctor double bill two insurance companies. You're watching two bills come through. You've got your two different logins for two different insurance companies that you've got to check on both sides. A lot of work, extra premiums, very rarely worth it. I think jumping back and forth in and out of the plans would have a more successful approach. But great question.
Got it. Well, thank you for the thorough answer.
Yeah.
Um, clearly, there's a lot of moving parts here. Um, you mentioned a couple of times during the presentation the idea of kind of aging out or pushing the students out of the nest, as it were. In your experience, Clarice, what are some ways that a person or parents can help their children or even grandchildren um, better prepare for the transition to managing their own healthcare?
I love that. This is a passionate question. So right in my heartstrings here, Russ. I, Healthcare isn't taught in high school. There isn't a class on healthcare, or really, unless you're going into the healthcare industry, it's not taught in college either. Much like any of you who have ever bought or owned your own home, you remember going through the process of figuring out mortgages and making offers and getting, inspections and all of that done. And I remember thinking, you could make a college class on how to buy a house. There's so much information and such a learning curve. Healthcare is exactly the same. There is a learning curve to it, and it's not taught except for handed down from parent to child. So, what I would do to prepare, the most important thing is start having conversations on the basic terminology. What is a deductible? What is the difference between a flat rate co-payment when you hand your doctor $20 at the time of your visit and a co-insurance? So maybe you have a 20% charge when you have a surgery at a hospital. What is an out-of-pocket maximum? What is a monthly premium? It's like your gym membership. You pay for it to get access to the healthcare, and whether or not you go to the gym, you're still paying for the gym membership every month. And then start talking about what is a provider network? Why does it financially matter if my doctor is in network or out of network? I like my doctor. What difference does it make? What kind of a financial impact is that going to have on me? I'm sure most of you have experienced these terminologies and these I want to say glossary terms or words, this lexicon in your own life, just by accidentally seeing a doctor who was out of network or not knowing whether you owed flat $20 or a percentage base and learning the hard way. These conversations can really help your student feel confident in their healthcare in the first place. The second and most important thing, Roz is going to back me up on this. Healthy habits that you start very early on can set you up for life. Same with finances. If your student has a good monthly operating budget, they know where their money's coming in, they know what money is going out, and it balances to a certain point. That's going to be huge for them, not only now but later in life when they're really spending, buying a house and sending their own kids to college. So healthcare has healthy habits too. When you get a new plan, you read the summary of benefits. You get familiar. You kind of know what your deductible should be. You kind of know if you're going to be paying flat rate co-payments or co-insurance. You kind of know who's in network. You take the time to look up the local hospital, the closest one, and say, is this in network with my health plan or do I got to go to the one across town? These kind of basic things can avoid major surprises, and it just gives you a familiarity. The final step is alarm bells. If you go to your pharmacy and you pick up your inhaler prescription, it's $5 every month, and then suddenly you go and it's 230. Whoa, what happened? Why is my inhaler $230? You call your insurance company. Hey, what's going on? What's happening with the cost of this? It's important to be able to recognize those alarm bells might not always be that obvious. That was a very obvious example. They might be more subtle than that, but recognizing when something doesn't seem right, when something seems out of place, and knowing that's the time to call your health insurance and to have a conversation and to figure out, was there an error? Was somebody just typed in the number wrong? Did they say I picked up 9 inhalers instead of 1? It happens. So it could be a typing error. It could be something more clerical. It could be a problem with your policy. Something wasn't filled in, so it got lapsed. Anything like that, recognizing those alarm bells is really critical. And then I would just say, kind of operating a healthy habit. Pick up your prescriptions when they're due. Go to your annual physical. Don't skip it. It's important. Get your cancer screenings. These kind of things, they come with time. We all kind of learn that as you approach adulthood and go into there. But having these conversations now, even though health insurance isn't the most exciting part of going to college, you're much more interested about decorating your dorm and finding out where all the cool hangout, cafes are and etc. I think it's important to establishing those good healthy habits that will make managing your healthcare so easy later in life.
Awesome.
Good question,
Thank you.
Russ. Yeah.
Yeah, and another question as we kind of start to wrap up. So let's say a parent or a student is going to the marketplace to evaluate and explore plans. When they report their income, do they have to report just their paycheck? Or maybe which incomes are included when figuring out marketplace plan options?
Good question. Officially, it's the I want to say I always call it MAGI, but I think it's MAGI. It's modified adjusted gross income, but they don't get that specific. They just ask you what is your estimated 2023 income, and you're going to put in a guess. The important thing is for family coverage, you need to list everyone in the household, even if they don't need coverage. So if you have mom and dad, mom has an employer plan that covers herself only, but doesn't give an option for dependents. So dad is going to get a marketplace plan for him and the children. He will list his wife and her date of birth in that enrollment process, but say she does not need coverage. So that way, your premium tax credit is really being assessed. As I told you, a single person making $50,000 is going to have a very different premium tax credit to a family of 4 in the same zip code making $50,000 trying to feed 4 mouths. They're going to have a bigger premium tax credit. So you want to list the whole family and everyone in it and the family joint filing income if you file jointly, even if someone doesn't need coverage. The trick is if your dependent is going to college out of state, so they're going to get their own health plan, and then your family is going to have one, in your home state, you both need to list everyone in the family if their child is still a tax dependent. So if you're still claiming them on your taxes as a dependent, they will need to list mom, dad, and siblings in their application and the family income. So they'll actually be listing mom and dad's income, but saying mom, dad, and my siblings don't need insurance. I'm the only one who needs insurance. Then on the family plan, you're going to drop that one dependent. So you're going to say mom and dad and maybe some of the siblings, but not this one. And the marketplace will actually reconcile premium tax credits for both, keeping a factor that there's two health plans, but the family is split across two locations. They're very clever and smart that way. If your child is not a tax dependent, they've officially moved out, they've got their own home, they're filing their own taxes, I'm not claiming them anymore, you can claim their income. And that can often be advantageous. It might be an initiative to kind of help them get their, can you say tax independence? Tax independence? To make them no longer dependent on your taxes because their income, especially if they're working part time in college or they have like, smaller hours, their income can get them a larger premium tax credit which they might be eligible for. Or maybe they'll qualify for Medicaid and they can have low or no cost health insurance. So that can be of a benefits of itself. That's worth plugging the different income numbers in and seeing how that looks. And maybe that's a choice when you guys choose to adjust your tax dependent status.
Got it. Thank you. If you're still with us this far, you've probably seen the maze that is our healthcare system, both for students and parents and grandparents and everyone else. And that is um, the primary reason why I've partnered with Clarice and the team at Caribou to better serve my clients in their health coverage decisions and planning as part of their broader, more holistic financial plan. Um, a slide or two back, Clarice showed kind of a snapshot of their health plan analysis, which can help students in this example or anyone really compare side by side their different coverage options and to evaluate the myriad of different factors that may be important to you that may or may not be important to your parents or to someone else to help you find the coverage that makes the most sense for you, both in terms of your healthcare needs, but also in terms of your financial resources and your stage of life and things like that. So I cannot tell you what a breath of fresh air it has been to work with Clarice and her coworkers at Caribou. I've gotten just across the board super positive reviews from my clients that I've walked through the health planning analysis consulting process with. And they've, 201, have all said, I learned a lot. I feel much more confident in my decisions now. And so, if anyone out there watching this would like to dig a little bit deeper into your own healthcare coverage and evaluating your options, especially if you or a family member are approaching one of those life transitions that was on that chart or that slide that Claire shared earlier. Please feel welcome to reach out to me. My contact information will be below this video. Clarice, thank you. Thank you to the entire team at Caribou. Anything you want to share with us before we wrap it up today?
No, thank you for watching. I think it's a huge step, not only for yourself, but also a great service that you're doing for your children and dependents. Sometimes I remember the being shoved out the nest. I think my mom waited 3 days before my room was turned into a sewing room. So I remember those times and being a little apprehensive, a little nervous. And the first time you're getting mail through the door, and you're like, what is all the stuff that I'm looking at? So I think just by watching this, you have already taken a huge step in the right direction, and your children will be grateful for any assistance that you can provide in this transitional phase.
Awesome. Well, thank you again, Clarice. Thanks everyone for joining us today, and we look forward to catching you next time.
It's been lovely. Have a great afternoon, everyone.
Bye bye.